Hey guys, so we're gonna be doing anxiety today, since we did, um, you know, depression yesterday. So this is just gonna be a basic, kind of verbatim, almost reading from the Wikipedia on anxiety. So anxiety is an emotion characterized by an unpleasant state of inner turmoil, often accompanied by nervous behaviors such as pacing back and forth, somatic complaints, and ruminations. Somatic complaints basically mean things that you can only feel, like, oh, my back hurts and there's no real cause for it, or I have a headache and I haven't really been doing anything that would make a headache, like drinking. I don't know, I'm not drinking, like eating ice cream too fast or being out in the sun, or I have a bad skin and I don't know why. And rumination. It is the subjectively unpleasant feelings of dread over anticipated events, such as the feeling of imminent death. It says need quotation to verify that. So, yeah, because I was gonna think that doesn't sound right. Like, it's more of a panic attack. Anyway, anxiety is a feeling of uneasiness and worry, usually generalized and unfocused, as an overreaction to a situation that is only subjectively seen as menacing. It is often accompanied by muscular tension, restlessness, fatigue, and problems in concentration. Anxiety can be appropriate, but when experienced regularly, the individual may suffer from an anxiety disorder. Anxiety is not the same as fear, which is a response to a real or perceived immediate threat. Anxiety involves the expectation of future threat. People facing anxiety may withdraw from situations which have provoked anxiety in the past. Now, obviously, we talked about social anxiety in the video. It's fairly familiar, common, well-known, right? So we'll touch on that again, although I'm talking more broadly about anxiety. So first thing we do is to differentiate between anxiety and fear. And honestly, I don't want to read it. It sounds stupid. I'm just going to move on. I mean, we all know the difference between anxiety and fear. Anxiety is fear that's overblown, above and beyond what would be considered normal evolutionary biological response, known as fear. Right. So we know this. We have natural fear responses. So let's go to symptoms of what is anxiety, how we differentiate from fear. Anxiety can be experienced with long, drawn-out daily symptoms that reduce quality of life, known as chronic or generalized anxiety, or it can be experienced in short spurts with sporadic stressful panic attacks, known as acute anxiety. Symptoms of anxiety can range in number, intensity, and frequency depending on the person. While almost everyone has experienced anxiety at some point in their lives, most do not develop long-term problems with anxiety. So it's common, most people have been touched by it. It's just that a lot of them don't develop these quote-unquote long-term problems or disorders. Anxiety may cause psychiatric and physiological symptoms. The risk of anxiety leading to depression could possibly even lead to an individual harming themselves, which is why there are many 24-hour suicide prevention hotlines. And I highly recommend, if you do feel that way, to call 911 or go on the Google and find out suicide hotline in my area. The behavioral effects of anxiety may include withdrawal from situations which have provoked anxiety or negative feelings in the past. Other effects may include changes in sleeping patterns, changes in habits, increase or decrease in food intake, and increased motor tension, such as foot tapping. Alright, just gonna put a cigarette out here. Foot tapping. Foot tapping? Sorry, I'm just getting all brown for some reason. Alright, wait. So, the emotional effects of anxiety may include feelings of apprehension or dread, trouble concentrating, feeling tension or jumpy, anticipating the worst, irritability, restlessness, watching and waiting for signs and occurrences of danger, and feeling like your mind's gone blank, as well as nightmares, bad dreams, obsessions about sensations, deja vu, a trapped in your mind feeling, and feeling like everything is scary. See, that's more of a better definition of anxiety. That's like the symptom of anxiety right there. Right? The physiological symptoms of anxiety may include, so these are the symptoms that you can kind of like almost, test, or neurological, such as headache, I don't know what I think that means like you feel like your face is kind of numb. I don't know. I can't pronounce this other word. Fasciculatations, which I guess means like parts of your brain. It sounds like parts of your face are kind of like there's more blood rushing to one part than the other through the veins. Vertigo, which obviously means like you're feeling dizzy, and presyncope, which basically I think means tunnel vision. You just have tunnel vision. So I've definitely had some of these. I've had tunnel vision. I've had headaches and stuff like that. Digestive symptoms such as abdominal pain, nausea, diarrhea, indigestion, dry mouth, or bolus. Yeah, that's basically what we're working on right now. The bolus, right, feeling like something stuck right in your throat. Dry mouth, you have that. Indigestion, I have acid reflux. Diarrhea, not so much. Not like I had it when I was first beginning my anxiety. I was first having social anxiety. I would have little like diarrhea at work. Nausea, pain, same kind of thing. It's not really diarrhea. It's just the feeling of just kind of get away. That kind of is connected to your gut and your brain. There's respiratory symptoms such as shortness of breath or sighing, breathing. Definitely I sigh a lot breathing. I mean, I sigh a lot, so much so that I've actually made a prayer every time I sigh. Alhamdulillah. So, alhamdulillah. Moving on, we got here cardiac as palpitations, tachycardia or chest pain. So basically, you're having heart palpitations. You're not having a regular heartbeat. Your heartbeat's too fast, or you're feeling pain in your chest. It happens to me time to time, not as much anymore. Although it does happen. You gotta differentiate between heart attacks and having an anxiety attack or being diagnosed with anxiety. Then there's muscular symptoms of fatigue, tremors, or tetany. I don't know what tetany is. I know everyone knows what fatigue and tremors are. There's cutaneous, such as precipitation or itchy skin, right? And there's also urogenital, as like frequent urination. Do that a lot. Urinary urgency, obviously I have that a lot. I don't know what dyspareunia is. I think that means inability to absorb fluids. Impotence, I know. I don't know if I'm impotent. It's just the symptoms. That's unfortunately we're having judgments on that. It's just kind of sad. That is a symptom of anxiety, and it does make you different. It doesn't make you different. Society says you're different. You have anxiety. You have anxiety. That's not a sense that it's not making you a worse person or a bad person or that you're somehow worse off. Anxiety is a common disorder that people have. Everyone's been touched by it, and we need to get over these 9-year-old things. Oh, he's impotent. He has anxiety. Chronic pelvic pain syndrome. Stress hormones released in an anxious state have an impact on bowel function and can manifest physical symptoms that may contribute to or exacerbate IBS, irritable bowel syndrome. So now there's types of anxiety. All right, there's different types. There are various types of anxieties. Existential anxiety can occur when a person faces angst, an existential crisis, or nihilistic feelings. So existentialism is like basically, why are we here? That thought is basically existentialism, and people can also feel that when they're anxious. People can also face mathematical anxiety, somatic anxiety, stage fright, or test anxiety. Social anxiety and stranger anxiety are causing people who are apprehensive around strangers or other people in general. Yeah, it's kind of true. There's a citation needed there. They have existential, I don't really want to get into that. Test and performance. It's basically the same kind of test as before, except these tests are for anxiety, not depression, so let's talk about it. According to Yerkes Dodson law, I guess this is a paper developed, or some sort of teaching sort of model. An optimal level of arousal is necessary to best complete a task, such as an exam, performance, or competitive event. However, when the anxiety or level of arousal exceeds that optimum, the result is a decline in performance. Test anxiety is the uneasiness, apprehension, or nervousness felt by students who have a fear of failing an exam. Students who have test anxiety may experience any of the following: the association of grades with personal worth, fear of embarrassment by a teacher, fear of alienation from parents or friends, time pressures, or feeling a loss of control. Sweating, dizziness, headaches, racing heartbeats, nausea, fidgeting, uncontrollable crying or laughing, and drumming on a desk are all common. Because test anxiety hinges on fear of negative evaluation, debate exists as to whether test anxiety is itself a unique anxiety disorder or whether it is a specific type of social phobia. Interesting. Because I never had test anxiety when I was growing up. Really, I didn't. I mean, things just came so easy for me. And the things that I didn't understand, I just realized, like we moved around so much, it didn't even matter sometimes the tests we took. So that probably has to play for that. That definitely does play for that. There's people that lived in the same place for 8-10 years, and they've taken the tests, and like the woman that we talked about in the video, she has social anxiety, and she from kindergarten to grade 6, she had to basically, you know, had no friends, and it took her a long time to make friends. So it's the same thing. When you're moving around a lot, there's no real kind of like impetus to force yourself to get out there. You can always be with your family. Tests are not important because, you know, especially around different countries. When you move from America to Canada or Canada to America, they have different testing symptoms. They just, different testing, you know, criteria, and they say, yeah, this is not important or this is important. So it definitely doesn't really bode well for someone who has anxiety in terms of wanting to cure it, because there's no point. Like, who cares if I don't feel anxious on this test? It doesn't matter. I'm moving to America next year anyway, right? So we talked about stranger, social, and intergroup anxiety. We've talked about this. One more little paragraph about test anxiety. While the term test anxiety refers specifically to students, many workers share the same experience with regard to their career or profession. The fear of failing at a task and being negatively evaluated for failure can have a similarly negative effect on the adult. Management of test anxiety focuses on achieving relaxation and developing mechanisms to manage anxiety. Then they have stranger anxiety, social anxiety, intergroup anxiety. There's a little bit about trait. Anxiety can be either a short-term state or a long-term personality trait, in quotation marks. So trait anxiety reflects a stable tendency across the lifespan of responding with acute state anxiety in the anticipation of threatening situations, whether they're actually deemed threatening or not. A meta-analysis showed that a high level of neuroticism is a risk factor for development of anxiety symptoms and disorders. Such anxiety may be conscious or unconscious. Sorry, just remember to tell you guys, my anxiety stayed the same while I was doing the exposure. It was like a 1, and it stayed at a 1. So just to let you guys know, that's just something I want to let you guys know. Personality can also be a trait leading towards anxiety and depression. Though experience may find it difficult to collect themselves, through experience, many find it difficult to collect themselves due to their own personal nature. This is something I just want to touch on real quick. We talked about this with depression. Ancients had this idea of melancholism, and we still have this idea to this present day of a sort of melancholic subtype of depression. Of depression. Yeah, it's the same thing here. There's people that are kind of like neurotic, that may or may not have social anxiety. It's just kind of like a trait they have. And I can believe that there's some people that are neurotic, they're kind of like melancholic, they're kind of like despondent, or, you know, like Edgar Allan Poe, Abraham Lincoln, people who, you know, had that personality trait of anxiety. They just didn't really kind of like let it interfere with their work or their occupation. Instead, they kind of realized it wasn't really a problem, and they like kind of worked, like they became creative from it. They kind of like said, oh, it's part of my personality, I guess, because they didn't know either that it was a symptom of another disorder and not a personality type, or they just didn't believe in that, or that research wasn't basically, you know, available at that time. I'm very convinced that ancients had a lot of information that we didn't know, including, for example, like anxiety, depression. Like, it's amazing for me that we can look up, you know, this type of anxiety, this type of depression, what's it called, melancholic, or whatever I was talking about from before. A melancholic subtype of anxiety is something that was brought over from thousands of years ago. Like, how did they know that? It's very interesting. All right, I'm not going to get too much into, like, you know, that whole mysticism or whatever, spirituality. This is a psychological channel. So anyway, anybody under the age of 18 may leave now, because I'm going to smoke a joint. Probably talk more about anxiety. So specifically social anxiety and how it works. Like we simply just covered right now the differentiation between anxiety and fear, and then we also covered the symptoms, right? And the symptoms are really, really important, because I've heard people that self-diagnose and it's not very good. And more importantly, symptoms are what, you know, kind of the criteria to separate anxiety from, let's say, depression or borderline personality disorder, right? It's all about symptoms. Choice or decision, I don't know what that means. It's interesting. Let me just have a cigarette. There's weed. Okay. Anxiety induced by the need to choose between similar options is increasingly being recognized as a problem for individuals and for organizations. In 2004, Capgemini Gemini wrote, "Today we're all faced with greater choice, more competition, and less time to consider options or seek out the right advice. In a decision context, unpredictability or uncertainty may trigger emotional responses in anxious individuals that systematically alter decision making. There are primary two forms of this anxiety type. The first form refers to a choice in which there are multiple potential outcomes with known or calculable probabilities. The second form refers to the uncertainty and ambiguity related to a decision context in which there are multiple possible outcomes with unknown probabilities." I think what he's trying to get at is, you know how you go to a store, there's like a gazillion different types of like soap or dishwashing detergent or, you know, like anything. People getting anxious trying to figure out which one is the best for the money and best for the features, and that can cause anxiety. It does for me sometimes. Usually I just like pick up whatever's cheapest or whatever brand I know, or just shop online, right? As I said, the internet helps a lot. Panic disorder. Okay, I'm going to move off on from that. Anxiety disorders. Yeah, let's talk about anxiety disorders. This is basically what I want to get into. Anxiety disorders are a group of mental disorders characterized by exaggerated feelings of anxiety and fear responses. Anxiety is a worry about future events, and fear is a reaction to current events. These feelings may cause physical symptoms such as a fast heart rate and shakiness. There are a number of anxiety disorders, including generalized anxiety disorder, specific phobia, social anxiety disorder, separation anxiety disorder, agoraphobia, panic disorder, and selective mutism. The disorders differ by what results in the symptoms. People often have more than one anxiety disorder. Obviously, this is okay. Let's keep going. Anxiety disorders are caused by a complex combination of genetic and environmental factors. To be diagnosed, symptoms typically need to be present for at least 6 months, be more than would be expected for the situation, and decrease a person's ability to function in their daily lives. Other problems that may result in similar symptoms include hypothyroidism, heart disease, caffeine, alcohol, or cannabis use, and withdrawal from certain drugs, and among others. So those are the differential diagnoses. So if you don't have depression, you could have hyperthyroidism, heart disease, using too much caffeine, using too much alcohol, or using too much cannabis. Without treatment, anxiety disorders tend to remain. Treatment may include lifestyle changes, counseling, and medications. Counseling is typically with a type of cognitive behavioral therapy. Medications such as antidepressants or beta blockers may improve symptoms. About 12% of people who are affected by anxiety disorder in a given year, and between 5 to 30% are affected at some point in their life. They occur about twice as often in women than they do in men, and generally begin before the age of 25. The most common are specific phobia, which affects nearly 12%, and social anxiety disorder, which affects 10%. So I have both of those at some point in their life. They affect those between the ages of 15 and 35, and the most, and become less common at the age of 55. Rates appear to be higher in the United States and Europe. Risk factors. Anxiety disorders are partially genetic, right? With twin studies suggesting 30 to 40% genetic influence on individuals' differences in anxiety. Environmental factors are also important. Twin studies show that individual-specific environments have a large influence on anxiety, whereas shared environmental influences, environments that affect twins in the same way, operate during childhood but decline through adolescence. Specific measured environments that have been associated with anxiety include child abuse, family history of mental health disorders, and poverty. Anxiety is also associated with drug use, including alcohol, caffeine, and benzodiazepines, which are often prescribed to treat anxiety. So, as you can see, there's a lot more work to be done. A lot of it's not very good in terms of like happy news. Doesn't mean all is lost. There's good things in here. Let's look at the good things. Apparently there's medical conditions, substance-induced, psychological, social treatment. So the first step in the management of personal anxiety symptoms involves evaluating the possible presence of an underlying medical cause whose recognition is essential in order to decide the correct treatment. Anxiety symptoms may mask an organic disease or appear associated with or as a result of a medical disorder. You need to remember that. Before you think you have anxiety, go to the doctor, get some lab work done, blood test done, rule out anything else, right? I fortunately had that happen to me after my diagnosis. For most people, though, I want this to be a warning. Don't go into your doctor and say, I have anxiety. Can you give me medication, or can you point me in the direction of the right therapist? Without first saying, I have anxiety, can I get some blood work done to rule out hypothyroidism, increase caffeine intake, you know what I mean? Or just me just having a rough time, because this is just normal, expected responses for a time like this. So important things to remember. Yeah, as much as I wanted to really talk about it at the moment. Usually I make my videos in the daytime. I took my medication today though, so it kind of knocks me out. So it's the nighttime. Alright, I hope this guys helps. So we did depression yesterday. The anxiety today. I only covered it quickly because I actually clicked on the wrong Wikipedia article. I clicked on the Wikipedia article that says was for anxiety. I'm supposed to pick on the Wikipedia article for anxiety disorder. So I understand how there wasn't as much information as you may have wanted. This is more of like folk history, folk pop kind of psychology. I'm sorry, just like yesterday, I accidentally clicked on the depression Wikipedia rather than the major depressive disorder Wikipedia article. Don't worry, we still learned a lot. We're going to tomorrow, though, do the right article, which is anxiety disorder. Basically, all we learned today is the difference between anxiety and fear, and some basic kind of like, causes, which is genetic. Other than that, though, I think most of the stuff you either knew. I'm sorry for wasting your time. We're going to do it tomorrow, though. I mean, we're going to definitely do it tomorrow, and I apologize for people who are like, oh, what is this? This isn't really a lot about anxiety. You're right, it's not. I actually just realized tomorrow will be Saturday. There won't be a video tomorrow. We'll do it Sunday. Okay, we'll pick it up Sunday. This has caused us this was a good video. You document my anxiety. You talked a little bit about anxiety. Though I would say we're really going to get into anxiety tomorrow. Like we talked about a bit today. Honestly, not a lot of it's not going to be as important as what we talk about on Sunday. All right, guys. So from a 1, 2, and 1. Remember, guys, stay with it.